and staff meeting to order. We'll start with the Diary's introduction.
Christy Rischel, Assistant Clerk.
Leslie Hervey, Clerk to the Board.
Stephanie Summerall, Dumas Commission.
Good afternoon. I'm County Commissioner Denise Treehouse.
Jeff Ludo, County Administrator.
Charlie Annis, Prosecutor's Office.
And I'm Hamilton County Commission President Alicia Reese. We got a couple items on the agenda, but I just wanted to. Okay, and I'm Hamilton County Commission President Alicia Reese. My mic wasn't on. Okay, we got a couple items on the agenda, but I just wanted to bring to the attention, today is the anniversary of the assassination of Dr. Martin Luther King Jr. and the impact that Dr. King has made. I just wanted to highlight this was a very tough day around the world. So I wanted to highlight that as well on this historic day. With that, I'd like to ask our Health Commissioner, Greg Hesterman, to come forward. It is also Public Health Week, and we'll get you a proclamation. Public Health Week is today, this week, and wanted you to come forward and talk about not just COVID, but if there's anything else you want to talk about as it relates to Public Health Week.
Thank you very much, and happy National Public Health Week to all of you as well. On our Twitter feed and Facebook feed, we are doing a highlight of different staff each day of this week and kind of highlighting some of the professions that public health makes up. So really proud of the team effort to highlight what public health does. We all know about pandemic response and we all know about food service inspections, but there's so much more. Today, I will update you on COVID and flu, kind of the normal slideshow, but I'll also kind of do a little bit of reflection as I talk about the end of the national public health emergency related to COVID-19. To start with, I will highlight that we are continuing to see COVID cases in our community on the decline. The map for March 24th, as you can see, is about a week late. If you were to look at today's map, which came out shortly after I published this presentation, there's no more red on the map. We're all either yellow or blue. So we continue to see all jurisdictions within Hamilton County with a decline of COVID-19. Statewide, we only have 13 jurisdictions that are in medium, and that continues to decline week after week. What we continue to see spread throughout the United States, including in this region, is the XBB.1.5, which is significant, as I continue to say for the last probably year now. These newer Omicron subvariants tend to spread easy, but they also tend to not make people very sick. And so why that's important, we continue over the last year, recalling that I show a year slide now as opposed to the entire pandemic, we continue to not see anything like that mountain that we saw back at the beginning of 2022, the end of 2021. This year has been fairly manageable. And I think what also is significant about this slide, you've heard me say many times, people aren't getting tested in the same way, meaning there is a lot of unreported cases on this slide. People are doing at-home test kits and not reporting it. Yet, for 2022, we saw even more cases than any other year during the pandemic, at least 20,000 more cases of reported COVID-19 last year than we saw in 2020 and 2021. That's important, though. Remember what I just said about less serious illness. So now we're going to kind of take a look. This is the entire pandemic. This is hospitalizations and intensive care unit admissions. Real quick, to compare to a month ago when I was last here, we were at 98. Today we were at 70. So we're heading in the right direction. But I think of most significance, when you look at that year after year, we have less hospitalizations than 2020, which had less cases, and 2021, which had less cases. So the seriousness of illness over the last year, even though we have more cases, has declined. And similarly, when you look at deaths associated with COVID-19 from the beginning of the pandemic, last year we had half as many deaths as we did in either of the prior 2 years. So we are continuing to see this pandemic taken care of in a way that we weren't able to in 2020 and 21. And so over the last few weeks, really over the last month or two, we've heard a lot of discussion about ending the national public health emergency. In fact, President Biden indicated that he intended to end the emergency on May 11th. And then just this past week, Congress passed a resolution, both the House and the Senate, putting a bill before President Biden, which would end the pandemic immediately upon signing. So sometime in the next week, we have heard that the president intends to sign that bill, which will officially end the national emergency associated with COVID-19. I think there still is a lot of work on the federal level, figuring out, making sure that there's still payment, access to tests, Medicare, Medicaid covers the necessary treatments. But at least we are changing how we look at COVID-19 nationally and managing it more on a day-to-day basis. Here in Hamilton County, we will see some shifts, at least with public health's involvement. On June 2nd, we're going to transition out of the public health vaccination clinic business. We will begin referring people back to those normal providers. We'll be working with some of those providers. We'll continue to maintain the Test and Protect site so people have easy access to that information. But in general, we're seeing very low utilization of our clinics. In fact, over the last 2 months, in general, I'm seeing less than 20 people a week at my vaccination clinics. So it's kind of that time. And so as funding is ending for us in some of these categories, we're seeing less public interest in our clinics, more interest in seeing vaccinations at your primary care physician or places closer to home, like your pharmacies at Kroger and CVS and Walgreens. We're seeing kind of utilization change. So that is my update on COVID-19. And then lastly, just flu. We only have 8 weeks left in the current flu season, and you can see no increases being the red line the current year. No increases in flu thus far, which is great news. So we hopefully will anticipate a slow end to flu season, including our reporting on flu for 2023. That is all I have prepared, but certainly happy to take any questions.
Thank you. Thank you for your presentation. I wanted to get back to the, of course, the presidential declaration and the closing of the vaccination clinics. I guess my first question is, at one point we were told it's kind of like the flu shot that we would have to take some type of booster each year. Is that still the case as it relates to COVID, or is that no longer the case?
So currently there is only one approved bivalent, and that is, it's been several months now. The anticipation is that yes, there will be likely kind of an annual cyclical process for getting your COVID-19 vaccine, just like the flu, but there is nothing approved. I've heard actually just more so in the recent weeks, potentially because of other parts of the world that have approved a second bivalent shot for those that are immunocompromised. There seems to be locally some interest in individuals getting a second shot, but that is not authorized yet and not permissible. So we're still kind of waiting for the FDA and the CDC to catch up with that thought and have some data behind that, but likely that's where we will end by the end of the year.
Okay. The reason I was asking that is that sometimes when we start to privatize the vaccinations, the cost tend to jump. And I just I didn't know if that would be necessary to have another shot, or will people be able to, because like right now, if you've gotten all your shots, there's an older gentleman that contacted me that I know, Oscar Wright, and he's older. I think might be close to 80 now. And he said all he has now is kind of a sore throat because he made sure he took all the shots. So is that the case? We have to re-up those? I guess that's the question. And then what that might cost. We were able to get a lot of people vaccinated because of the work and our partnership with you and others to be able to provide it where we took cost off the table.
I think truly COVID will continue to evolve, including the national response. I think I don't have a crystal ball to know definitively if we will have another booster, although the science seems to be stacking up and the professional community seems to be of the belief, yes, we will have a requirement to get or a recommendation to get another shot this fall. If that happens and it's under the current scheme, it would likely then defer to private pharmacies. Most individuals with insurance, including public insurance like Medicare and Medicaid, would be covered just like the flu shot. But I think time will have to tell on what federal policies are around future vaccinations.
Gotcha, thank you. And this is not to you, I would just say public health, and since it's Public Health Week, but has to me never gotten, I used to chair the health committee at City Hall. I don't even think they have a health committee anymore, but I chaired the health committee, and they used to say, oh, this is the smallest committee that's there. Because public health has never gotten, I think, the importance of attention, funding, seat at the table until we saw a pandemic. And then everybody's, oh my God, public health is so important. You know, your health is your wealth, which we knew. So I just want to make sure we're not going to go backwards. COVID was a bad thing, but it did have some good things that happened. People started cleaning more than they've, you know, in these restaurants that were a lot cleaner. Public spaces were a lot cleaner. And we also were a major collaborator, that we were able to bring all the people together and put the silos down. And I just hope there's some way we could keep that attitude and that infrastructure in place, because Lord forbid something else happens, we want to be ready to kind of rock and roll. So I just wanted to commend you for that, but also to let, I think, everyone know, and from our perspective, political folks, folks in office, folks that over budgets, that we don't want to go back to how we were, where if you know, your insurance is not at this hospital, it's at that hospital. Oh, we don't take this type of insurance, or we don't do that. We don't want to go back to that, or, you know, stickiness in the restaurants, or stickiness on the airplanes. I mean, it seems like we're going back to some things that, you know, they weren't the right thing to do. Covering your mouth when you're coughing, washing your hands. We shouldn't let that leave with COVID. We should always cover our mouth and wash our hands. So it's just some of those things I hope we can keep, I don't know, promoting or keep going. And then also, as you're at those tables, articulating the important role that you all played in public health to provide. We took the cost barrier down, and we collaborated and took the silos down. So I hope that this could be examples that we can use going forward and not go back. Let's go back to before COVID. No, some of that stuff before COVID was not good, and we did not respect public health like we should, in my opinion.
I appreciate that, and I certainly agree with the importance of making sure that public health messaging continues to be forefront, as well as support for programming. It does a lot of good in the community, and oftentimes what we do is not in the public view, and in many ways that's okay with us, but it's also really important that some of this messaging gets out and we continue to make positive progress.
Thank you. Vice President Driehaus.
Thank you. Happy Health Worker Appreciation Week. I think it's good.
Thank you.
Yes, much deserved. Please tell your team that we're grateful for all their work. Two things. Wanted to thank you for the long view. I've never seen that long view of where we came from, where we were, and where we are now. It's really interesting to see the dips, you know, the heights, the dips, in all of that, and as you say, the impact of one variant versus another, and where we are today in this long journey related to COVID. So I too want to appreciate, or say that I'm appreciative of the partnership between public health and the county and the hospitals and all the partners that work so hard throughout this journey to try to inform citizens and make sure people are as safe as possible. So thank you for that. As you talked about the vaccine clinic kind of winding down, I just wanted to note that our testing is also winding down. I think that we were in the right place at the right time, providing this service to the county residents both by way of the vaccines and by way of the testing, but I agree that we're at this moment in time now where it should be absorbed into the regular health system, where people go to their provider as they would for a flu shot and get the access to medication or the shot in that way. And so our testing too has dwindled, and we are winding down too. So I appreciate kind of you pointing out the trajectory of what's happening out in the community. And I know a ton of people that have COVID right now. It's just that they don't have a bad case of it. And people are still, thankfully, trying to isolate themselves and to try to keep other people safe. But as we hear about that and the numbers, you know, who are the people? We know who was at risk when we first started all of this. Are those the same people that are still at risk and still the folks that we should be worried about if we find that we've got COVID or somebody has COVID, trying to keep them away from certain individuals with certain kinds of medical conditions?
Yes, that is correct. So individuals with autoimmune disease or individuals who are over, we'll say, the age of 60 typically are at higher risk. And we would encourage, if you have a private primary care physician, discussing your illness with them and figuring out if there are certain instances in which you should take higher caution. You've heard me say this hundreds of times over the course of the last 3 years, but masks do help spread the spread of infectious disease. And pre-COVID-19, individuals who were receiving autoimmune disease treatments often wore masks because it was an effective tool for dealing with the spread of disease. So it's something you should discuss with your physician. If you're at higher risk, you might want to avoid really crowded locations, or if you're going to a family gathering, one might want to be more sensitive if someone is sick.
Okay, thank you. And thanks again for the partnership, Greg.
Absolutely. Thank you.
Commissioner Dumas.
Thank you, Madam Chair. Thank you for all that you do and your staff, as usual.
Thank
A
you.
great report. And the bottom line is COVID is still out there, and we need not to forget that. When I looked at your data, the deaths have decreased by half, which is awesome. We wish it was more. But I was a little surprised about the hospitalization. It was only down like 200 from 20 and 21. And I'm just wondering, are people being more precautionary, or why do you think the numbers are about the same in the hospital?
I think, would it be possible to put the data slide back up? If it's too much trouble, I can talk through it. One of the major contributors to 2021's hospitalizations deals with cases. So remembering that this represents only the tip of the iceberg, if you look at that mountain, the Mount Everest on this diagram, that happens in December of 2021 and January of 2022. Hospitalizations are delayed. And so when we look over at the hospitalization chart, you can see Mount Everest. The Omicron Mount Everest appears primarily in January of 2022. So it was that initial wave of Omicron coming across Hamilton County and the country that caused 2022's hospitalizations to be so high. I hate to use the crystal ball analogy, but if you look next year at 2023, I suspect we won't see hospitalizations anywhere as close to what we saw even last year.
Can we go to the next slide?
Yep.
We just missed it right before the, okay.
Which the hospitalization.
Yeah, the hospitalization. Yeah, 2,200, okay. Okay, so it's going down, but
It is.
not as
It's
much as we wanted to.
Yep.
So, thank you so much, I appreciate it.
You're welcome. Thank you.
Thank you, Commissioner Kesterman. In our next presentation that we do with us, can we talk about the what they call long COVID, and maybe going a little bit more in there? Because as you've said now, that people, if you get COVID now, most people are not dying. Of course, one person is too much, as we all indicated, but we are making some investments as we're getting rid of testing and we're getting rid of vaccinations. And maybe this is for Jeff. We're gonna, on Thursday, we're gonna be voting on some equipment that we're putting in hospitals. And it was because of COVID. I wanna make sure this equipment we're doing is still needed, still relevant, and still fits the need. And then I also want to know about people who now are suffering. I don't know if you have data on that, but anything that you have would be helpful. So we can look at those people, I guess, because I know some people that got COVID and the person, they're not that old and they can't hardly breathe again. They're living, but it has affected their life. And I remember you had said one time there was a waiting list, or a lot of people, or UC had a waiting list to try to get into the facility that we put some money toward, but that long COVID, you had said one time, will be something we'd have to deal with.
Yes, certainly. I can provide some slides or potentially ask one of our partners to help share some data that would be relevant to this discussion.
Thank you. That'd be great, because that's a public health issue, because if you got long-term COVID, you got a long-term bill. And
Absolutely.
I know public health is, our goal is always to try to take that barrier away if possible.
Absolutely.
Thank you so much.
Thank you.
So much for being here, Commissioner Kesterman. Thank you very much. And Jeff, you'll be able to get us some information maybe before Thursday. I just want to make sure we're not investing in equipment that's no longer needed.
Yeah, no. So just very briefly, the ARPA public health investments that the board would be voting on Thursday are related to two things. First is a data platform, which is would be funded through the county through Children's Hospital to help track and coordinate and share data related to disease outbreaks in the community. So it's an information and IT system that will help us track and coordinate information in the future. So something that the community needs regardless of where we are in the COVID lifespan. The other grant relates to negative air pressure rooms and UV disinfection at a few Mercy Hospital facilities. So again, when, unfortunately, probably not if, the next type of pandemic happens, those types of negative air pressure rooms are going to be very important to handling the flow of people that are going into hospitals, et cetera. So nothing the board would be voted on would be obsolete based upon the information we've received today or the glide path we're on with COVID.
Thank you for that clarification. Next on our agenda is Beyond Your Imagination update from JFS Director Michael Patton and Melissa Henry.
Good afternoon, board. Thank you for having us this afternoon. Glad to be here to talk to you a little bit about Beyond Your Imagination. Beyond Your Imagination began with Commissioner Dumas thinking about how we might be able to provide opportunities to youth in care, unique opportunities to youth in care with Job and Family Services to make sure that they have an opportunity to really experience the type of enrichment activities that some other children in our community are able to experience. And so we heard about the idea, we met with the team, and our Children's Services Project leader, Melissa Henry, really jumped on it. So I've asked her to come and talk about where we are with that process and where the plan is exactly today. So we have a brief presentation to update the board on where things stand as it relates to Beyond Your Imagination. So I will turn it over to Melissa, and she'll talk through where we are with respect to the program. So thank you very much.
Welcome.
Hello, board. Thank you for inviting us today to talk about Beyond Your Imagination. And like Director Patton said, this came from Commissioner Simmer Dumas, who brought this to us. And there's a quote that she had in one of the emails that came my way that I think really exemplifies what we were looking for. She said, "I want the children in these living situations to start to dream again, to believe again, and begin to expect more. I want them to realize that they are special in a great way, and any positive thing that other children can experience, they can too." So I think that's really poignant. And you know, our agency works really hard to keep kids safe and keeps families together and support families. And this is just another extension of that care that we provide our children. So the program details. So this program is for any youth in the care of Children's Services ages 14 and up. So right now there's about 500 youth that's in the care of our agency. And it's for all children that are in placement types across the board. So that would be your traditional foster homes, kinship care, which is where family members or individuals known to the child take care of them, group homes, independent, or residential placement. So regardless of their placement, we still have opportunities for them. It provides access to a variety of cultural and social enrichment activities. We have created a calendar of events that the youth can select from, or their caregivers, depending on who is completing the form. And the cost of tickets or enrollment is covered by our agency. And we're also starting to get some donations, so that's wonderful as well. Additional tickets to events may be available for family members or caregivers to attend, especially if you have a 14-year-old who wants to go to a concert. We'd want to send a caregiver along with them. Here's some examples of some of the activities that we have on our calendar: concerts, musicals, plays, sport camps, cultural awareness activities, sporting events, museums, special events, special interest camps, and family activities. So we have everything on our calendar from art camp to self-defense classes to ceramics classes to musical opportunities, and we're looking for something that will fit. Everybody will have something that fits their needs and interests. And it's a real simple process for people to request tickets or enrollment. So we are working on our calendar right now. Hopefully that will be launching on our webpage soon. And they look at the calendar, they click on it. You guys know how this works. You look at an event, and then there's a form that you fill out to request. And then myself and my team, we will look at the use eligibility and make sure that's a good fit for the child. And then we'll communicate with the requester and let them know what the time frame is and make sure that we're communicating them regularly to get them their tickets. We're going to try to do everything as electronically if we can, but we also know that some of our youth and some of our caregivers may not have technology, so we also want to make sure that they have a paper option as well. We will continually update the calendar to add new events and remove sold out events to make sure that it's updated. There's also an opportunity for youth and caregivers to email us and let us know of additional options that they're interested in. So if there's an activity that's not on the calendar, we'll hear about it and we'll see if we can provide that opportunity to them. And if it's something that we think that might be of interest to other individuals, we'll add it to the calendar. The webpage is in the final development stage. We will message it out to all of our provider networks and internally within Children's Services via multiple channels of communication, so once it's live. So we want to make sure that the foster parents, that our provider organizations like that manage the foster parents, the youth group homes, and all of those different places get the information. We're going to be talking to them at administrative and executive level, and we'll also be talking to the people that actually work inside those agencies to make sure that everyone knows that it's available. And that's what I have to present. I would love to hear questions.
Yeah, thank you for that presentation. I'm going to start with Commissioner Dumas because this was her initiative that she brought to the board. And so I would like to start with you, if that's okay, Vice President.
Thank you, Madam Chair. I'm getting a little emotional up here for a couple reasons. When you read what I had sent you, I got it. But also the fact that when I introduced the idea to the board and also to you guys, you just grabbed it and you took it and you ran with it. And so I guess the emotional part is that I'm thinking about those young girls and boys who thought they were different because they were in an environment that was different. But they don't have to be different. They're great, as you were saying, and they can do those things that other young children can do, even though they don't have the money. We're going to provide that. And so just the fact that you guys ran with it just showed me it doesn't take forever. When there's an idea and we have some money there and the board is supportive, we can move forward. So for my fellow commissioners, my colleagues, that if you see anything in the paper, somebody's coming, this concert is coming, like I always send him emails, Director Patton, in the middle of the night, did you know that? So if you see something you think it would be good for our young people, just, I don't know what's the best way to send it to you or to let, because we don't see them all, but I'm just so excited. And so you guys are doing a little bit of this already and have been doing some of this, but then we kind of put a name on it and we specialize the children that we would be working with. So I am just so grateful for this.
Thank you, Vice President Treehouse.
Thank you. Thanks for the presentation. I too love this idea. Thank you, Commissioner Dumas, for bringing it forward. My lens is one of having served as a board member on the Cincinnati Recreation Commission for 16 years and also having a lot of affinity for extracurricular activities for kids, whether it's sports or entertainment or concerts or music, plays or whatever it is. You're going to capture the imagination or the interest, at least, of youth, given the broad variety of things that you are now focusing in on and offering. So I think that's great. And I think every kid deserves the opportunity, especially the kids that have suffered some kind of trauma. The only reason they're in our system is because they've suffered some kind of trauma. And so I think it will be great for them and also for the families that are caring for them. So, and you are better positioned than anybody through the kinship care program, the foster care program, to know where those kids are, what their needs are, and interact with those families to make sure that they're being served by this program. So, yeah, it sounds great. Thanks again to Commissioner Dumas for bringing it forward, and I'll be excited to hear some of the anecdotal stories of the kids participating in the program and having the benefit of going to these concerts or whatever kind of activity they choose. Thanks.
Thank you. I want to join in thanking Commissioner Dumas for bringing this forward and staying on it, saying, hey, we're not just bringing it forward, let's get it going, let's move. We're getting ready to go into the summer months. School is getting ready to be out, and my philosophy has always been we must get our program to the youth before the street program gets to the youth. A program will get to them. It's up to us which program that will be. And so I am so excited because a child does not have a choice who they're born to. If they did, they might, be instead like, nah, I'm not gonna come out right now. I'm gonna choose another family. So whatever circumstance they're born into, that's what they have to deal with. But it's up to us to make sure that they can dream beyond their circumstances. And the only way you can do that is to expose them to things that are beyond what they're exposed to. Otherwise, you can't break the cycle. And we are a county that has a number of events, and we've got, professional sports teams here. We've got, the biggest concerts coming. We got all these venues that we've got all this coming here, all these parks and all this recreational stuff. But it doesn't mean anything if the people that live here have to look out a window and say, wow, I can't be a part of that. And so as we are talking about One Hamilton County, I think it fits right in. And you never know, a kid goes see someone and that might be the thing that changed. Like, oh, I want to do this. And we hear these stories all the time. So I'm happy to support this. I want to thank, again, Commissioner Dumas for bringing it forward and staying on it. And I want to thank you all for moving quickly and swiftly as summer's around the corner that we can. And I like this camps. Most people cannot afford camps.
Absolutely.
Camps are way different than when I was growing up. It's just very expensive. So what do they say? Well, don't go to camp, just stay home. Now you got 2 or 3 months of no development. So I love the part about putting them in different, there's a million camps now. I mean, cooking camps, and that's a gazillion camps out there that you can be a part of. So again, I think it fits well with what this board is doing. We have been unapologetic, saying that we are standing up for our youth, that we're going to do everything we can through the Office of Youth that has a number of umbrellas under it, like this, Beyond Your Imagination. So excited about it, and thank you so much for putting this together. Great job.
Thank you.
Okay, now we have an executive session.
Madam Chair?
Oh, I'm so sorry. Commissioner Dumas?
If I could just make a comment, and wonder if we can have a moment of silence for the Springfield Township officer that lost his life this week, and also William Dunson, who lost his life, a citizen of Hamilton County, because our flags are now flying half-staff, and so we wanted the residents to know that we do recognize that.
Absolutely. I was going to do it Thursday, but we can do it today.
Yeah.
Let's take a moment of silence. Amen.
Thank you.
Okay, anything else? Vice President Trick? Nope. Anything? I know it's a quick meeting. I'm sure y'all don't have anything else.
We're not finished yet. We've got exec session. So.
Okay, item number 3, executive session pursuant to Ohio Revised Code Section 121.22G4 to discuss collective bargaining with Director of our Jobs and Family Services, our Labor, Employee Relations Manager, et cetera.
I'll second the motion.
Commissioner Reese.
Yes.
Commissioner Dreehouse.
Yes.
Commissioner Summer Dumas.
Yes.